Have you ever walked into a room and forgot what you went in there for? Have you ever misplaced your wallet or your purse? What about losing your keys? This is something fairly common, and it happens to the best of us. But have you ever forgotten where you lived? Have you ever forgotten the names of your children? What about forgetting how to brush your teeth or comb your hair? Or maybe you're just simply confused all the time. Simple things complex you. If you're 65 years or older, this could be something very serious. This could be dementia. Dementia is not a specific disease, but is rather a general term for the impaired ability to remember, think, or make decisions that interfere with doing everyday activities. Some people think that dementia is normal and it happens to everybody as they get old. But this is not true. Dementia is not a normal part of aging. Can dementia be cured? Dementia is a progressive disease. There is no cure for it, but it can be treated if detected early, and this can help slow down its development. The different forms of dementia are Alzheimer's, vascular dementia, Lewy body dementia, and mixed dementia. Alzheimer's is the most common and the one we know the most. Vascular dementia can cause its sufferer to have strokes. Lewy body dementia can cause the sufferer to become rigid or have shakes. And mixed dementia can be any combination of these. Some cognitive symptoms of dementia are memory loss and inability to communicate or recall words, difficulty reasoning and problem solving, inability to complete complex tasks, difficulty with organizing and planning, diminished coordination and fine motor skills, confusion and disorientation, and visual impairment. Now, some of the physical symptoms of dementia can be personality changes, depression and anxiety, inappropriate behavior, paranoia, agitation, and hallucinations. So, what causes dementia? Dementia is caused by damaged or loss of nerve cells and their connections in the brain. Inside of our brain, there are billions of nerve cells, and these nerve cells are all connected. You can think of these connections like a highway. And when traffic is flowing correctly, there's proteins and hormones and electrical currents that are sent freely. This helps keep the nerve cells healthy, and in turn, that keeps our brain healthy. A person who suffers from dementia has these highways damaged. Once enough of these highways are all damaged, this nerve cell will die. And because dementia is progressive, this will then move on to another set of nerve cells, and this will continue to happen. Typically, the first signs of dementia happen here in the amygdala and the hippocampus. These are what control our memory and decision making. This is where we start to notice something's not quite right. Eventually, it will affect the basal ganglia and the thalamus. Some of the risk factors for dementia are age and genetics. These are things we can't control, no matter how hard we try. Somebody who has a family history of dementia is at a higher risk of contracting it later in life. Diet and exercise, smoking and alcohol, these are things we can't control. We can have a better diet, a well-balanced diet with omega-3 fatty acids, and we can exercise for at least 30 minutes a day. We can quit smoking and drink less. There's also diabetes, head trauma, depression, and air pollution. I'm a licensed CNA, and I have experience with dementia not only professionally, but personally as well. I completed my nursing training at Blight Post-Acute, and I also work as an in-home care nurse. Some of My clients have had dementia, mostly Alzheimer's, and I can say that no two people are the same, and the way dementia affects them can be totally different from one another. In my personal life, my grandmother had Alzheimer's. I was able to ask her a lot of questions, and I found something wasn't quite right, and I was able to talk her into going to see a doctor. And I credit my knowledge of dementia for giving me a few more years with my grandmother, because it was detected early enough to where she could start treatment and slow down the progression. In conclusion, dementia is not a normal part of getting older. People around the age of 65 or older are at high risk of dementia. Memory loss and difficulty speaking are often the first signs of dementia. Dementia can be treated if detected early, but there is no cure. We cannot change our age or genetics. However, the things we can change are how we eat, how active we are, and our vices. This can help to decrease our chances of getting dementia.